at all. I
Just
don't.
having pelvic pain.
I hurt myself really bad, and I don't
Write
know.
your name, date of birth, PCP.
I don't know what I did, but it
Fell
hurt.
or what happened?
I did end up falling down, but it was as soon as I jumped up and was trying to chase this other dog and get this other dog off of her. After that, I went to walk, and it's like my whole pelvis.
Just right. It's okay.
Just gave out on me, and I went down.
It's a disaster.
Already trying to give me issues saying that Maya can't come with me.
I don't have nothing to do with that. I'm perfectly cool.
There's no reason she
about
can't.
OB upstairs.
Oh, I've already talked to labor and delivery before. She's allowed. My doctor has said she's allowed.
Yeah, I'm perfectly happy with your dog hunt.
Yeah, no, you're fine.
I understand, but
Oh yeah, I'm recording. Already.
What's different?
Nothing is
So
different.
just fall pelvic pain.
Both.
Okay. You're 36 weeks.
I'm supposed to be induced in 12 days because baby's not getting enough oxygen and growth restriction.
They said no.
She said no.
All right, I got Dominique Weems here. Okay, so yeah, that's. All right, so the dog can't come. I'm
She's
sorry.
a service dog. That's against federal law, and I'm recording this right now.
That's fine. Listen,
I've already been told labor
here's my
delivery.
job, and that's to get you upstairs safely. And
I
know
have
you want your
medical
dog.
conditions. I
know
cannot
you
be
want
separated
your
from her.
dog, But we need to get you upstairs. The head CNO is telling me no. I can't do it. So can I
They
please
let
take
her
it?
upstairs before, so I don't
Well,
understand
labor
the
and
difference.
delivery just called me personally and said no.
And I've spoken to labor and delivery
dog.
before. It's
I'm
against
totally cool
federal.
with dogs.
I have medical conditions. She is legally allowed to be with me. You legally cannot deny me. And by y'all doing this, I am videoing right now. This entire hospital can be sued. I have talked to labor and delivery. She is legally allowed. I've been into labor and delivery multiple times in the past. Dr. Schulman is aware that I have her, is aware that she's going to be there with me when I'm in labor.
You have to understand, I'm an ER person. I'm just trying to take you upstairs. That's my job. I'm not up there. I'm down here. I'm trying to help
Then just
you.
take me
This
upstairs
is
and
what
I'll
they told
argue
me
with
to do.
them.
I cannot bring the dog with that. I'm not trying to stop you again. I love dogs. I'm totally cool with it. I'm just doing what
She's
I'm
a
told.
service animal. It's against federal law. The only place that she is not legally allowed in a hospital.
I am.
Somebody want to talk to you on the phone.
Okay.
So we need to help. We need to make sure your baby's okay. And
And my medical issues, I need her. You can't tell me before certain things happen. She can't. I'm in a lot of pain. I've spoken to labor and delivery. Labor and delivery told me I was all good having a service animal because legally she cannot be denied access. My doctor, my OB, is aware that she's going to be there with me when I'm in labor because of my medical conditions. And this is against federal law right now.
1746.
Come. The only places in the hospital she is not legally allowed is a burn unit or an operating room. Dr. Schulman is aware that she's going to be there with me, babe. Labor and delivery has told me before it would not be an issue. Maya, sit. I've been told by labor and delivery before that it would not be an issue. And it's illegal. It is violating federal law, and I swear to God, I will sue this hospital if I have to. That is how I'm feeling right now. I'm in a lot of pain, and I just want my treatment. Sit. Legally, they cannot separate me from her.
Okay, is this a service dog?
Yes.
Do you have your papers?
There is no paperwork. She is a service dog for medical. alert and response and PTSD response. These are the 88 federal laws. If you guys want to look over these,
I mean, I understand that, but you're supposed to have paper.
no, there's paperwork.
Like 10 minutes ago and told me it was a patient coming with the service animal and she's supposed to be coming upstairs. They told me to not let the dog upstairs.
I have been reassured by labor and delivery that she would be with me. Dr. Schulman is where she's going to be with me when I am in labor.
Okay,
I've-
stop talking for me. You said they told you what?
They told me to not let the dog upstairs.
Okay.
That's against federal law, and I swear I will sue this hospital. Everything is being videoed right now. This
We don't care nothing about that.
she
If
is.
they said that the dog can't go, then the dog can't go.
That's against federal
I
law.
don't have nothing to do with that. We have to just do what we were told to do.
Okay, and I'm sorry. What's your name?
None of your business.
None of my business, ma'am. Excuse me. It is my business because
Ma'am.
no,
You can't videotape it.
I can because this is against federal.
Record all you want. What we're saying right now is
She
No,
cannot be
listen,
separated
listen,
from me.
Listen,
Sir, they're saying it's okay, so calm down.
I never got loud.
You're in my face. You were bent over in my face.
So we
Talking
trying
to
to
you.
look around.
It's
You
the
can't talk
COVID
loud. You cannot.
Y'all
talk
are
loud.
also. I have PTSD, and you are all surrounding me right now. What do you expect? I am in pain.
No,
And y'all are all around me.
mask. Go get her a mask. See, do you know COVID is out?
Yes, I'm aware.
Okay.
And nobody offered me a mask when I
should've
came
came
in.
with one. You
I
didn't
didn't have one because I just hurt myself, and my husband had to pick me up to rush me up here. I'm already having to be
Okay,
induced because of issues with my baby.
Okay, we're not trying to upset you, but we have to. The safety of the
Nobody wants to
hospital.
just. I hear that, and I don't
Put that
mind.
on while you talking. Put that on.
I don't mind a mask because somebody would have just handed it to me when I got here.
Who is this?
That's my husband.
She's coming down.
Okay.
But she's got severe anxiety and PTSD, so I would appreciate it. Just,
There's a labor and delivery nurse right there.
Okay. Hey.
Thank you.
Dr. Schulman knows that she's going to be with me when I'm in labor. I've been already told by.
Okay, listen, sweetheart, we can't do this out here. What I do want you to understand, I am the director for the division. I've talked with Dr. Schulman, and I've talked with the nurses.
Okay.
Your precious dog at 7 months won't meet the criteria for service dog for anxiety. There's a bunch
Yes,
of
she
questions.
does. What do you know about federal law?
Okay.
I have a
I'm
YouTube channel. I have a YouTube channel, and
Do
this
you
is what I
want to
do.
be seen and screened for the fall that you happen
What
to have
criteria
based
do
on
you
this?
need for her?
We're gonna get Lisa on the phone and let her talk to you. How about that?
Huh?
Will that work? We can get Lisa on the phone and let her talk to you about it.
I'm just wondering, what questions do you need to ask me? Go ahead.
She's gonna ask them, okay? I'm out
Whatever.
of it. I'm gonna let her talk to you. Okay?
Whether she is in training or fully trained, she is legally allowed per Alabama state law and per federal law.
You fell down because your dog got into it with another dog or something?
No, I had another dog attack her,
Okay, that's what happened.
and I went to run. I jumped up and went to run to get the other dog off of her.
Right.
After that, I was in, I don't know what I did when I jumped up, but I went to try to get my 4-year-old, and we went to try to walk away to leave because we were at the dog park and they were running
Fall
around.
down? That's what-
Yes,
I'm good.
it was after the fact. But I had this other dog jumping at her in her face trying to bite her, and she's just trying to run away from it.
They're probably just gonna check her out right there, and if so, you and the dog.
She can't be
just go
separated.
outside.
This
how
is
that's-
against federal law.
that's
My
how that's
hospital can
probably
be
gonna go.
sued.
Unless they're in a surgical environment, the dog does not have to leave her.
Unless it's a burn unit or I'm in an operating room. Those are the only two places she is not legally allowed.
Federally.
That is
If
federal
they-
law
if
and
they
Alabama
say-
state law.
If they say that it don't meet the criteria,
Then I guess we're going to have a great lawsuit on our hands. That is how I feel right now.
There's several other hospitals here that should go to.
She is for PTSD and medical. She is behaving like... Oh.
We need to call Brian here security.
Oh, this is going to be a wonderful lawsuit.
I'm really
I've already been reassured by labor and delivery that there would be no issues. I was reassured by Dr. Schulman.
They feel like that's not legal.
Hello? Okay, we have this pregnant woman in here with a service dog. She says she is for medical reasons.
And PTSD response.
Yeah.
Medical and PTSD response.
Medical and PTSD response.
Yeah.
She don't have any papers
There are no papers
on the
legally.
dog.
ADA law.
That's federal law. There are legally no
Okay.
papers.
Well, upstairs, they said that
I'm a service dog advocate. That's what I do. Is I advocate for service dogs and invisible disabilities. That is my job.
7 months, or she's 7 months or something. The dog is not being allowed to go to labor and delivery, and she wants to sue.
She will
and this
stay out of the
all
way.
Kind of foolishness.
I'll be in my bed. She'll be
The
on the
thing
floor,
was,
out of the way.
the thing was, she's not in labor. She, another dog was trying to attack her dog or something. And she ended up falling. So she really just needs to be seen just for falling to the emergency room. And so,
That's one of the other patients.
How many hospitals have I been in with her?
okay,
Can't
listen,
tell you how many.
listen. This is the director over security. As far as her being seen for her fall, the dog can go back there to be seen. But if she was to go just in the ER, if she was to go upstairs to the labor and delivery, a lot of service dogs, it would not pass because they cannot go to sterile places.
Unless it's an operating room or a burn unit, she can't be in there. My doctor, Dr. Shulman, is fully aware that she is going to be there with me when I go into labor. When I am in labor, while I am at the hospital, she's going to be with me. He's going to be taking me. And Dr. Shulman talked about it yesterday. He will walk her out to use the bathroom. He will bring her back in because obviously he can't leave hospital grounds anyway. So he will be there to help assist me take care of her while she's helping take care of me. Dr. Shulman was petting her yesterday, trying to get to know her a little bit while I was going under.
And actually do it down here because based on what's happening with COVID and infection prevention, you know,
I've
if
been
it's
into
not a situation where we're going to go do a quick surgery and that kind of thing, then we'll screen her here.
I've been into multiple labor and deliveries.
Okay, and what about a house supervisor too?
That's not
This
a
is
bad
Brian.
idea.
This is Brian. Our
That's not a
director.
bad idea. Go
So
ahead and let
you
me
can call the house
them.
supervisor and let them make the
yeah.
decision.
And your name's Stephanie, and
It
you're
is
the director
Armstead.
of
But
Women's
she's saying
and
that she
Children.
talked to her
Yeah, I've talked to labor and delivery here, and they said it wouldn't be an issue. When I've called before, I've been into labor. I just got transferred over to Grandview.
From where?
I was at UAB. She's been up to labor and delivery with me at UAB multiple times. She is legally allowed. That's federal law and Alabama state law. It does not matter what is going on. She is still legally allowed with me because there's things that she can do that you guys cannot do. Even though y'all might be able to treat the matter afterwards, she can help assist me with the matter during. All she does is when we are in a room, my husband sits in the chair and she's in the chair next to him, sitting on the floor.
Okay, well, there's something she doesn't want us to hear.
With patients that have had service dogs, and I remember most of their names, like Phaedra and...
So what's the issue right now? Like the two legal questions. Is she a service dog required for disability? Yes. Is she task trained? What task is she trained to perform? She is task trained for PTSD response. She is in training for medical alert and medical response.
Were you able to figure anything out? Were you able to figure anything out?
I have, these are ADA federal law. I have the card.
That's why we're not disputing. Okay, look, we're not disputing. We see that, but we're just trying to make sure dogs are allowed here. Those
Service animals.
Service animals are allowed here, but not in certain areas. Not in sterile.
Legally.
No, listen. Not in sterile.
And sterile environments, correct.
And
that would be
listen, it says too, maybe not like in the labor room. It's pending. It's on our website.
No,
and so,
Dr. Shulman has already said that she could be there.
Listen.
I mean, I keep getting interrupted when I keep trying to explain that Dr. Shulman has said
he's
it.
going to send it to me. My phone number is, you got my email? Or you go,
Dr. Shulman's already said it was fine. I've had my other doctor.
2512.
You did hear her say that. He said that the dog would be there during labor.
Like she has her own bag packed for the days that we're supposed to be here. Right now, it's for my rights.
No, but I'm saying you cannot do that in our hospital.
That's
it's on,
right
it's
now.
It's on the doors.
And I wouldn't be right now if we weren't having this issue. So I hope that's understandable. We're having an issue right now. This is my protection, ADA. This is my protection if I have to sue.
She called the house supervisor. Hold on. That's just coming down.
I am a YouTuber. It is my job. I
She's in the
actively,
emergency room.
It's a liability.
I advocate
and the,
for service dogs and disabilities
We're giving
so
issue.
that people don't have to go through this.
Okay. Okay. Yeah, Brian for the call right back. I'm trying to find it. My boss just sent me the link to read. Let me see. Service animal dog. General type.
But I'm trying to figure out if it goes against what her doctor told her about the dog being in
See,
there.
the thing is, a doctor don't make the rules.
I understand
It goes
that.
from administration, and doctors
What about
can't tell
federal
you
law?
that.
Why would he tell her that though?
Because see, it's still
Because
sterile.
he's following federal law. It's
no,
not.
it's still sterile.
There have been service animals allowed in labors before. They are posted all over the internet if you want to look it up about service animals being there in labor rooms. It's a sterile environment for me, but unless I am having an open C-section,
He's gonna hospital. Yeah.
unless I'm having a C-section, she would not be allowed in there, and she would not be allowed into a burn unit. She legally can still be there with me when I'm in labor, though. Back up, back up.
Oh, let me just slam through.
Good. Come. Right here. Sit. Good girl.
Well, time is precious, so let's hope something really isn't wrong.
I mean, I'm already having to be induced because I might have a stillbirth because my baby's not getting enough oxygen, so.
Now they're gonna take you back to the back and let you get checked out. That's not the problem.
When it's already been 30 minutes.
Well, I don't know how long you've been here. I'm sorry.
I mean, the moment I came in, it was immediately an issue, and legally, that's not. This is all against federal law. It goes against Alabama state laws. This is completely 100% legal.
For a service and before, from operating room
Mm-hmm.
or burn units for the animal present.
Yes.
A service animal must be under the control of an animal.
This is ADA federal law as well. These are the little mini cards from the ADA, the same page that you're reading from right now. That's what I just recited to you is the burn unit, the operating room. Those are the only places in the hospital that she would not legally be allowed where y'all could legally turn her down. And I'm sorry if I'm coming off, I'm in a lot of pain.
I understand,
you know,
and I want you to go get checked. And I know you can
tell.
It's a good dog.
You can tell by her behavior that she's not going to be an issue. She's behaving, and I've never had issues like this.
We can see that. We can see that. So I don't want you to get upset. They're going to see you. They're going to see you. So don't.
But now I'm wondering what's going to happen when I go into labor. Am I going to be in labor coming up for my induction in 12 days having the same issue?
If the house supervisor don't say I guess the third floor is coming down.
Labor and delivery isn't
to do a screen.
technically a I just came from UAB. She has been in labor and delivery with me at Brookwood before I got transferred to UAB, and then UAB transferred me out, saying I was no longer high risk, and then we found out that I am high risk. I'm supposed to be induced in 12 days. Legally, per federal law, per Alabama state law, this is illegal for you guys to do, and this is going to be a huge lawsuit on y'all's hands if that's the case. Dr. Schulman knows that she's going to be in the labor room with me.
It's a different, he's doing his part, and he called me to handle his part, okay? I'm Lori, I'm the infection control professional here.
So he called her to handle this.
Don't get upset. They come down here to screen you. So that's the first thing.
I know, but now I'm trying to figure out I'm supposed to be induced in 11 days. My baby's is growth restricted and not getting enough oxygen, so they're having to induce me early just to try to make sure that he's okay. And I've never, every other hospital that I've been at, I was at Brookwood before they transferred me to UAB, thinking I was high risk, and then UAB said, oh, you're fine, nothing's wrong with you and the baby. They do an ultrasound yesterday and then find out, oh, actually something is still wrong. And that's the only reason I'm even here. I'd rather be back at UAB right now, because UAB never, I was in labor and delivery at UAB, like 2 or 3 weeks ago, because I passed out and hit my head, because that's part of my medical issues. I pass out a lot. Just one of the reasons I've got her.
Okay, so they're gonna check you out down here, okay?
Okay.
But we are not set up to be able to allow a service animal into the labor and delivery area.
Then why did UAB do it? Why did Brookwood do it?
I can't answer for those facilities. And I'm very good friends with those
Maya, leave
people
it.
there, and they have similar
Come here.
policies. Also, the COVID pandemic has exploded, and so we're all wearing a mask, and there are even more special precautions in place, and it's for your protection.
But federal law, that doesn't matter. Would you deny me access with my oxygen tank or my wheelchair if I came in with my oxygen or a wheelchair?
I hear you. I do. I hear you.
She is medical equipment in the eyes of federal law. So if you would not deny me access, if I came in with an oxygen tank or if I came in with a wheelchair.
She's with you now. She is with you now.
But what about when I go into labor?
Go in a sterile procedure per the law.
That's an operating room or a burn unit.
It doesn't say operating room. The
There have been, it does specifically under federal law, it does specifically state the two places as an operating room and a burn unit.
They use those as examples. And so,
Okay.
hang on, I wrote it. Procedural suites.
There have been many service animals.
This is verbatim. Pre-op
Labor
area
and delivery
recovery.
rooms. If I was to have a
What it is,
C-section,
we have special.
I want to see the law where it says
Yeah,
she
those
can't.
were examples. We have.
No, they're not
there's-
just examples.
There's even special air exchanges that occur so that you don't get a post-op infection. Okay, there's special air exchange, like there's positive pressure, negative pressure. In delivering, it's positive pressure, and there's so many air exchanges that have to occur, and that's kind of considered that same special area. But we want you to be checked out and make sure you're okay. All right, now, so the animal is fine down here with you, but it would not be able to go to the L&D area.
And that makes no sense
Right.
because she has been to labor and delivery at other hospitals with me.
Yeah.
Dr. Schulman was aware she was going to be with me. Other service animals, it has been on the news about other service animals
Hey, I'm
being.
one of the biggest fans of service animals. I have a 120-pound
We're not
Shih Tzu
trying to
German.
argue.
I understand.
My job is, I'm a YouTuber. My whole job, though, is because I literally advocate for service animals and disabilities.
That's awesome.
I know the laws like the back of my hand. This is
Another
not.
thing, so the handler, these are their rights and responsibilities. So the handler for the dog will be, who will be the handler?
She is mine. I am the handler until if I go into labor and I'm in the bed, he will take control
When a
and
patient
he will walk her.
When a patient is in the hospital, the patient cannot be the handler.
Then
That's
he's the
in
handler. Then he
so-
can be the handler.
so that's, the law says that too.
But
Because
as
the
a whole, she's
patient-
for me, yes. But he can take charge of her.
Right, and so none of the staff can touch
And
or
that's
pet
fine.
or anything. If the animal growls, barks, is disruptive,
Y'all have every right to remove.
then you know that.
Yes.
And then any kind of, if she needs to go outside while she's in the ER.
That's his job.
Yeah. So I just want to be sure you got
Yeah,
that.
that's something we've already been prepared for.
You're not the only one that this is affected to, and we have made, we're going like extra provisions and going an extra mile to try to be advocates for service animals. But in that procedural area, it just cannot go in there. It's no different from walking into an operating room. You have sterile
Then that would be
setups.
the case at every hospital,
Well,
not
I
just
can
here.
only speak for my hospital. Okay,
But there
I
will
hear
be
you.
no operating done. There will be no
I'm just
Yeah,
being
done.
induced. There have been that's not.
that
Well,
is,
she's induced, yes.
If she has to step out of the room for a moment,
Well,
I'm
she's
sure
not
my
gonna
husband
be
can
able
step
to-
her out of the room. But
She
other
wouldn't
than
be able to be in that room because that is a sterile procedure when you deliver and the baby and the cutting the cord and all those things. But I want you to be okay tonight. Okay. Let's make sure you didn't. How did you? What happened with you? Did you fall?
I went to the dog park with her, and my 4-year-old wanted to go, so we went as quick as I could to
Bless your heart. So
run.
you just.
I went to run at them to try to get this other dog off of her. Luckily, she's fine. No punctures, no bleeding. Maya, sit. And then I went to leave, and as I went to leave, the pelvic pressure and the pain started so bad I just dropped.
All right. This is what Maya is her name?
Yes.
This is for Maya. You don't have to put it on her. Okay, but this is our visual indicator to let the people down here know
If you want to put it on there,
that
you
she is
can.
okay to be down here. Okay.
Okay.
She wants to go, can she go back there with her?
Yeah, she can go back to the treatment room and the yeah, that's fine.
To get in touch with labor and delivery before I get induced in 12 days.
Yeah, so I've spoken with them, and they,
So y'all just aren't going to allow it as a hospital.
right.
Well, I guess at least I've got that on video, and I guess I'll proceed with what legal actions I need. Thank y'all.
We just want to make sure you're okay.
Are
right
you
now.
filming me right now?
I've been filming the entire situation.
Okay, so that's
Because it's ADA federal law, and when I was immediately told that she's not allowed, I've got to protect myself with the
She
law.
is allowed everywhere that visitors and patients could normally go without infection prevention precautions in place, but not in a labor and delivery procedural operating room
But that's
area.
not how it's been at every other hospital I've been to. So,
And Dr. Shulman said
and Dr.
she
Shulman was
could be
fully
there
aware that she
while
was going to be there.
in labor.
He called me because he said that you had shared that with him. He called me to help you and to assess everything.
Okay.
For everybody's
Did
protection.
he mention that he was at?
Yes. He that's why he called me. So because that's our policy is that infection control department is aware when we have a service animal and they make sure that everything's in order and.
So he
you have-
wasn't an authority to say that the dog
Correct.
could be
Correct.
in there.
I don't know that I want to be here anymore. Can we just leave? Can we go somewhere else? Please. I don't even get it. I don't want to be here anymore. This is not okay. Thank you. And they're bending over, leaning over, like in my face. I've never been treated so bad before. There's only... Give me my bag. I'm stuck here, having issues with her. And then what are you gonna do? Sit down? Like, I really don't want to be here anymore. Austin, please. No, I don't want to be here anymore. I have a right to my treatment. I have a right to the treatment I receive, and this is not what I want right now. I'm going to be sitting here waiting for another 20, 30 minutes anyway. At that point, we'll be at UAB. UAB will get me straight in.
6:45.
So much better. After everything that's happened, you think they're going to do a decent job here? Honestly. Honestly.
I feel like as long as this one is there. Alright.
No. They wanted to surround me with security guards and everything else, have people bent over in my face. And this is it. We're leaving. I'm not doing this. We've been over here for over an hour. They won't bring me up to labor and delivery. I'm 36 weeks pregnant. I can't do this anymore. We're going to a different hospital. Maya, it's a good girl.
Better get some care, okay? We just left Grandview and they gave us so many problems. Yeah, we just got transferred from here at UAB.
I just got off the phone with someone in LND and she said to come on up. Thank you. Right. And then left. Well, she said they did. This is how you should be treated when you go into a hospital with a service animal. Huh.
Going up. This is third floor, right?
Yes, third floor. Thank you.
Okay, let your feet up. Push it. Okay.
Yeah, that's not gonna happen. Not with the way my hips hurt. Ow. What you guys here for today? I was at the dog park and me, my 4-year-old, and my service dog, they were running around playing, and then somebody brought in an aggressive dog that immediately started trying to attack her. So I got my 4-year-old out of the way, and then I jumped up and ran, trying to get this other dog away from my service dog because he was literally trying to like rip her face apart. And I guess I hurt myself somehow. I ended up falling, and I am in so much pain right now. My pelvis, like the pelvic area, I cannot walk. He is literally picking me up to put me in the car and picking me up to get me out of the car. I can't. I'm in
They're supposed to be induced in 12
yeah,
days.
and I'm supposed to be induced in 12 days. Baby's low oxygen, small. He's 4 pounds 3 ounces right now from the ultrasound yesterday. I'm supposed to have 2 more ultrasounds next week. I'm going under fetal stress monitoring and just a lot.
Okay. All right. Wait right over here. We're going to get you back in the room in just a second.
Okay, thank you. No. Good girl.
I think you remember us.
Huh?
I think you might remember
I don't know if I was with you last time. Miss Debbie's here, and she said she remembered you from the last time you were here.
Oh my God, thank goodness. We just had UAB transfer me to Grandview because they said I was no longer high risk. They were wrong. I am still high risk, and I'm supposed to be induced in 12 days. We went to Grandview because I had an accident earlier. I literally like cannot walk right now. I'm in so much pain. Like my baby's having issues, and I didn't know where else to go.
You're perfect here.
I've seen you before. Grandview just gave me the worst because UAB transferred me to Grandview saying I was no longer high risk. I still am. Allowing me, they refused to allow me up to labor and delivery and everything else. And
let's take care of you here.
Yes.
thank y'all
Okay?
so much. I really didn't know where else to go.
So you've been here before, so you know the deal.
Yep.
You're here for pelvic pain.
I can barely walk. So, and thank you to UAB for getting me in immediately. Like, does this say UAB on this? I don't think it does. Where's your shirt? I already showed that. Maya, guess what? Up here in labor and delivery with me. No problems, no questions asked. They're treating me so much better. I'm still like anxiety ridden, but this is how a hospital should treat you. What Grandview just did was ridiculous. That was so uncalled for. So we are in the MEU at UAB. So this is on the labor and delivery floor. They have no issue with my service dog being here with me now or when I'm in labor. I'm actually finally hooked up to the monitors to keep an eye on the baby. And I cannot believe what we just went through at Grandview. Like, I just got transferred over there, and I cannot believe what I just went through with them. I've never, like, you have a pregnant woman in pain, possibly going into labor, and you want to argue about her service animal that is allowed under federal law, and then make her wait for over an hour. So this is how it should be. I'm high risk again, so I hate that UAB missed that to begin with, but we know now, and I'm at the point where I want to come back to UAB because they are always so nice. I've already had the doctor come in. She's talked to me. She's checked me. Maya is in the corner with my husband. No problem. Like, she legally should be allowed to be. So I'm just going to try to relax. And they are picking up a few contractions. So we're just going to keep an eye, make sure nothing like that gets worse. And keep an eye on the baby's heart, and then try to figure out why I am in so much pain after the incident that we went through. So